Go. Okay, this is the heart. Around it would be a sac called the pericardium. The inner part of the sac is this part here called the epicardium. Then you would look at the myocardium, and then inside would be the endocardium. Those are the layers. On the outside, you have adipose tissue. Then you have coronary arteries, which come out of the base of the aorta. This will be the right coronary artery. This will be the left coronary artery. So the right coronary artery starts right here, and it's going to come around here to the right side. Right coronary artery, marginal artery. On the left side, the left coronary artery goes from the base of the aorta just to right here, which is number 48. Then the left coronary artery splits into the circumflex artery underneath the auricle and the anterior interventricular artery. The other artery is on the back, called the posterior interventricular artery. The cardiac veins. This is the middle cardiac vein. Remember, the middle one was in the back. You have the anterior cardiac vein, small cardiac vein, great cardiac vein, and the middle one in the back. They all dump into the coronary sinus, which will then dump into the right atrium. That's the coronary circulation. Okay. This is the right auricle. This is the left auricle. Right atrium, right ventricle, left atrium, left ventricle. Superior vena cava to the right atrium. Inferior vena cava to the right atrium. And the opening to the coronary sinus to the right atrium. Three things. This is the foramen ovale if it's a fetal heart. This is an adult heart, so it's called fossa ovalis. This is the tricuspid valve, which is an atrioventricular valve. This is the chordae tendineae. Be careful how many E's there are. These are the papillary muscles. These are the trabeculae carneae, bridges of meat. This is the bicuspid valve, the aortic valve, and the pulmonary valve will be in here on the bottom of the pulmonary trunk. Sinoatrial node, atrioventricular node. Bundle of His. Kind of hard to see because they're white lines, but bundle of His. Bundle branches, there's the left and the right. And then these are the Purkinje fibers on both sides. Here. This is the ascending aorta, the aortic arch, or arch of aorta, and then here starts the descending aorta. This used to be the ductus arteriosus, now it's the ligamentum arteriosum. This is the pulmonary trunk. Let's put this back on so you can see. Okay? So pulmonary trunk, aorta, superior vena cava. On the aortic arch, remember there are three things that come off. The first one is the brachiocephalic trunk. This will split into the right common carotid artery in the neck and the right subclavian artery that goes down the arm. This middle one is going to go straight up into the neck. This is the left common carotid artery, and this is the left subclavian artery that will go down the left arm. These are pulmonary, so remember they're reversed. So these are the left pulmonary veins. When you look on this side, this is the right side now, right? So this is the right pulmonary veins, right pulmonary arteries. Okay, remember it's reversed for pulmonary. I'm going to return this around. This is the trachea, the carina. This is the back. So this is the right primary bronchus, left primary bronchus. That's it.